So we're going to be talking about a lot of things around acute pain, around the jaw, around the face and things like that, but most people don't even know what their face looks like without skin.
Well, they look at themselves all the time, but yes, they don't actually.
Or look at other people.
Yeah.
But we're going to be looking at sort of the raw of what we are. Yeah, because you're going to talk a little bit more about muscle tension and balance and things like that, but most of that is derived about how your jaw and structures are placed, where your head position is on your spine, because if those bones are not in the correct alignment, that's what's producing the muscle tension, because it's being pulled into a different direction. So simple techniques and
what I normally equate it to is carrying a pail of water right next to you or a little bit away from you. Yeah, it weighs you down. It's just that constant strain on the muscles that actually just makes them go into dysfunction.
Anyway,
so most of the acute pain is in any of the TMJ dysfunctions is muscle related and fascia related, and easily rectified. There's a bigger picture there, and other things can kick in obviously, but we can affect the muscles.
You and I know this very clearly. We understand the difference between muscle and fascia, but fascia is still a very hot topic out there. Not many people know it. People are dropping fascia terms all the time, but they don't understand what it is, and that it is so much a part of us, not just our outside covering of our muscles. It's our muscles. It's the segmentation of things.
Absolutely.
The face is made up of a lot of muscles, but a lot of fascia.
A lot of fascia all over.
Should we do a quick fascia release?
Okay.
Put your hand on your forehead. Take the other hand to the back of your neck or your occiput. So we're putting one hand here and one hand here. And all you're going to be doing is sliding the skin surface forward and backward. And it's such a simple thing to do, but let's not do it fast. Let's do it really slowly and bring in your breathing with it as well. Doesn't matter which way you breathe, as long as you're breathing in and you're breathing out. So that's that forward and backward motion. So the top of the skull, got a lot of fascia lining on top of it. And then just release your hands and just notice how you're sitting now. One, how's your breathing? What's your mood even, if that's changed slightly? And then what we're going to do is we're going to take our hands onto the sides of the skull like this, and we're going to sort of do a left and a right tilt. So we pull down on one side and pull up on the other, or push down on one and pull up on the other, however you want to feel it in your head. And again, you're just sliding that skin over the next layer, which is fascia, over the next layer, which is potential muscle, over the next layer, which is bone. And then releasing that. I think I might have to redo my hair now.
and we can do further down here as well, and down here. And there's obviously professionals that can do that.
Yeah.
Massage. And some of the studies will come out now and say that massage is actually less muscle than it is fascia. It's actually the manipulation of the fascia that's releasing the blood flow, that's releasing the tension. Because fascia is connective tissue and literally connects the things together. And it's almost like a sock that goes all the way around. There's this interesting thing called the deep anterior fascial line that goes all the way from the tongue down here to the diaphragm, around the buttocks, side of the knee, ends up at the foot. And it's all connected. It's all just kind of related. It's like a string in a bow. You pull it, eventually it will go down. So it's all kind of here to actually end up playing down, all through the fascia.
And it's so simple. If you've got a pet at home, do you have pets?
I have three.
So I have a little dog, and I play with his skin all the time, and I touch him like this and I move his skin, and that just helps the freedom. It's the same as here. So a lot of people have neck tension. So, let's do this one. So just rubbing the skin surface along here. You don't even really have to know what you're touching or doing. It's just the touch is what's important, because those proprioceptive neurons, which are telling our body where we are in space, navigating us, those are embedded within the fascia, and it's like a Wi-Fi network of telling us where we are. So when we're touching this, we're feeding the brain new information all the time, and the brain's going, oh wow, that feels better than I did 2 seconds ago, give me more of that.
And it can actually change that that spiritual side of it, the mind side of it, psychosomatically, and that we are what we think to some extent. And if we concentrate on the problems, those problems actually become worse. So kind of taking the brain out of it as well by overload of information through the proprioception can help a lot.